Good evening to all the viewers. Welcome to the IJCP chat show on safe interventions for prolonged wet cough in children. I'm Dr. Shweta Ghadge from the medical team of USV. Cough is the most common pediatric problem managed by doctors. There are multiple causes of cough, and extended duration of coughing causes stress to both the children and their parents. Management of cough is difficult since effectiveness of traditional medications to either cure or relieve the symptoms of cough in children is a challenge. To discuss more on the challenges on the current management of productive cough and the use of dried ivy leaf extract cough syrup, I welcome Dr. Meenakshi Verma, ma'am, Senior Consultant Pediatrician at Sparsh Clinic Panchkula and is a member of Indian Academy of Pediatrics. Welcome, ma'am, to the IJCP chat show, and thank you for engaging with us today. Since we
Thank
are
you.
discussing on the challenges. Yes, since we are discussing on the challenges of cough medications, so can you give a broad idea of what dried ivy leaf extract is and how it is effective in treatment of productive cough?
Yeah, good evening, Dr. Shweta. The productive cough, which in children we call it better as wet cough because they are not able to expel their mucus or the secretions, whatever are there in their upper or lower airways. They're not able to expel it out. So we better call it wet cough. So the wet cough is a very great challenge for managing as per the parents are concerned and as per the physicians are concerned. It's very difficult to first of all diagnose that and then to treat that, manage that. So we have been facing a lot of challenges nowadays. Even if there are a number of viral infections which are occurring in children nowadays after that COVID lockdown. In last 2 months, we have seen so many cases coming to us, and almost all of the viral respiratory infections they are having resolved wet cough occurring for a prolonged period. So in such cases, we need to have something which can decrease the viscosity of the mucus so that child is better able to cough it out, expel it out. And we need something which opens up the airways of the children so that the mucociliary clearance and the mucus drainage is improved. So we need to have those cough syrups, which we can say. Till now, we have some over-the-counter drugs which are available, and most of them are the fixed dose combinations. So, why combinations are needed as cough syrups? Because some or the other ingredient had some of the other property. So, like which of the properties which we need are the mucolytic properties, so that they can thin out the mucus and the children can expel it out. Then we need a bronchospasmolytic property, so that bronchodilation occurs and the children feel better. So, and other anti-inflammatory, antibacterial properties are needed. That's why fixed dose combinations are coming in the market. But there is one such product which is called dried ivy leaf extract. This product has probably all those properties which are needed for easing out this management of this wet cough in children or productive cough in children. What basically is this ivy leaf extract? Ivy leaf is the leaf of a plant which is Hedera helix, which we call it. So the leaves they are extracted from this plant. It is dried and it is formulated in the form of cough syrups. The main active ingredient or constituent which helps in relieving the symptoms in this dried ivy leaf extract is saponin. Saponin contains a compound Hedera C, and when we consume this syrup, when children consume this syrup, this gets hydrolyzed to a compound which is called alpha hedarin. And this alpha hedarin is the active constituent. It has all those properties which we needed, like mucolytic properties, bronchodilating, or we can say bronchospasmolytic property. It has anti-inflammatory property also. Then it has antibacterial and a number of other properties. So how it acts? It acts by combining two beta adrenergic receptors which are present in the airways, upper and as well as lower airways. So these beta adrenergic receptors they cannot get internalized, and then their effect, the adrenaline effect on these receptors gets increased. And what are the adrenaline effects? Adrenaline effects are those of the mucolytic effect. How does it do mucolysis? It does it by increasing the surfactant production. So surfactant is it helps in thinning out the mucus, and this mucus it then can easily expelled out. Children don't have to don't have to do much of the efforts to expel this mucus out of their lungs and airways. So, and another adrenaline effect is bronchodilation. Yes, it causes bronchodilation also to a very great extent, and again helps in relieving the symptoms like breathlessness and wheezing. So, and the other component which is there in this ivy leaf extract is flavonoids. This flavonoid have those antioxidant as well as anti-inflammatory properties, and which are also helpful in curbing the infection, in curing the disease to some extent. So, in a nutshell, we can say the dry ivy leaf extract can be a very good alternative to those combinations, cough syrups which are available in the market.
Hmm. Wonderfully explained the entire, how, firstly, the complications with wet cough, or, that is seen in children, and how distressing it is, and the role of dried ivy leaf extract, and the constituents on how they individually work in alleviating symptoms, or, in wet cough. So, thank you, ma'am, for such a wonderful explanation of that. I am sure that viewers will get a lot of are getting a lot of information from this, explanation of the role of dried ivy leaf extract and cough syrup. So, ma'am, since you mentioned about productive or wet cough, can it also relieve symptoms of acute bronchitis?
Yeah, acute bronchitis, what does it mean? It means the acute inflammation of the bronchi, which are the larger airways in the lungs. So, inflammation of the bronchi leads to bronchospasm, which is the most difficult problem when it happens in children. This bronchospasm creates a lot of respiratory distress in children. They are having a lot of cough bouts, almost 15, 20, 30 cough bouts a day. Then they are having night awakenings because of that cough. So when children are not sleeping, so when children are not sleeping, parents are also not sleeping. So it causes a lot of anxiety in whole of the family. So this acute bronchitis, since it is having those all those conditions like inflammation and mucus secretions and bronchospasm, so for which the dried ivy leaf extract will be a very good option if we use it in the form of cough syrups. And this, because of its mucolytic, bronchospasmolytic properties, anti-inflammatory properties, it will help a great extent to relieve those symptoms of acute bronchitis, and hence to relieve the anxiety of the parents and the whole family, and hence to improve the general well-being of the child.
Right, yes. When correctly mentioned that, dried ivy leaf extract does not just have one property that will alleviate one particular symptom, but due to its multi, properties that it has of mucolytic, bronchospasmolytic, all of these properties help in alleviating the multiple symptoms of acute bronchitis. So, that is also an important information for, viewers to understand. It does not only help in productive cough, but also in acute bronchitis and various such upper respiratory tract infections. So, ma'am, you mentioned about, how there's no effort that the child needs to put while coughing out the sputum. So, ma'am, can how or, can it also help in expectoration in very young children?
Expectoration in very young children is needed very it is needed a lot, because young children, they don't know what is happening, they don't know that he or she has to expel it out. So what is the result of it is that they do vomitings. The vomiting out the mucus is something which worries the parents as well. So in those young children, if we use dried ivy leaf extract, yes, it will help a lot to them. And in fact, some studies also have been conducted, clinical trials have been conducted in children as below as 6 months of age also, to which them, when the dry leaf extract cough syrups were given, they have shown marked improvement. The response time which was occurring in relieving the symptoms was at an average of 2 days, 2 to 3 days. So they had got relief very early. Then it has also helped in alleviating the secretions which were stuck in the throat. So the children, because of this mucolysis which has happened because of this cough syrup, they were very easily take out the mucus, which have reduced the vomitings to a larger extent. So yes, in young children also it has been proved to be helpful as per the clinical trials which were performed.
Right, right. Yes, ma'am. And another important point that you just mentioned, that the relief time is, the quickest with dried ivy leaf extract cough syrup as compared to other conventional products. So, I'm talking about, conventionally available or commercially available products. how beneficial dried ivy leaf extract is as compared to say acetylcysteine or ambroxol in children with upper respiratory tract infections.
Acetylcysteine and ambroxol, they also have been used very widely. They also have been used for their mucolytic properties. And the clinical trials which have been done, which are done in large scale of children which were involved in these trials, both in both the studies, it was compared, the ivy leaf extract compared to N-acetylcysteine, and then ivy leaf extract as compared to ambroxol. So these studies were done in which it was observed that the results of both the groups were comparable. That means the ivy leaf extract was as effective as ambroxol and acetylcysteine in alleviating the symptoms, in mucus clearance, in providing the relief of breathlessness, then in improving the wheezing of the child. So it was comparable. And in fact, the safety profile, if we see, safety profile was better. It was better tolerated in children in which ivy leaf extract was given. So, considering its safety profile, its better tolerability, it was very well recommended, and because of this reason, it was approved by DCGI also, that it can be recommended in respiratory diseases, may it be upper respiratory infections or acute or chronic bronchitis, and even bronchial asthma. Also, in some cases, it has been used as an adjuvant therapy. So, yes. Since it is as effective as ambroxol and acetylcysteine, we can use it as an effective therapeutic regime in the form of cough syrups and alternative to ambroxol and acetylcysteine.
Hmm. Yes, ma'am. Talking about again about ambroxol and acetylcysteine, even though they are being effective, there is always challenges or apprehension in doctors to prescribe these medications. So, in terms of that, can you also highlight and considering safety of dried ivy leaf extract cough syrup when compared to the commercially available medications? If you could highlight something about that.
The coming to the safety profile of this IV dried leaf extract, the trials which were conducted, they have shown a very good safety profile, as per the parents also and as per the physicians also. The adverse drug reactions, if we see in the other cough syrups which are having antihistamines or decongestants or the other anti-inflammatory combinations which were present in that, so they can cause dizziness, sedation, drowsiness, headaches. Sometimes they can cause palpitations, and in larger doses, if they are consumed, they can cause arrhythmias even. But in those studies, the adverse effects, only effects which were seen with ivy leaf extract was just mild gastrointestinal disturbances, and that too in very very small number of patients. So since its tolerability was very high, its safety profile was proved to be very low, very high, and the other thing which was observed was its acceptance. Acceptance by children is a very good factor, which is very important in children. So if they won't accept any medicine, how will the symptoms will be relieved? So
Yeah.
acceptance because of its taste is very very important factor, and if it is combined with safety profile, so yes, it's a very good alternative. I believe extract.
Right. Yes, ma'am. Especially, the taste part, the pleasant taste is something that is extremely important, and rightly mentioned by you that unless the child takes the medication, the symptoms are not going to be relieved. And with dried ivy leaf extract cough syrup, taste being a key parameter here, it does, is widely accepted by children. So that is also an important aspect too for the viewers to take. Ma'am, since you also mentioned about importance of dosage and certain medications are taken for a long time or a lot of it quantity wise. So is that something of concern in with dried ivy leaf extract? Like if you could highlight the the dosage and the duration that can be given to very young children.
Uh, Regarding the dosage of ivy leaf extract, it's very convenient. Like in younger children, in 1 to 5 year of age, we can give it 2.5 ml 3 times a day. We need to give it, and in the more older children, 5 to 12 year of age, we need to give it 5 ml 3 times a day, and then in more than 12 years old and adults, 7.5 ml 3 times a day to be given, and it is to be given just for 7 days. though effect starts within 48 hours, 48 to 72 hours, there is marked improvement in symptoms. We can continue it for next 7 days to for complete alleviation of the symptoms which is needed. So
Hmm.
dosage profile is also very convenient, and if it is acceptance is also not an issue. So it's very good and safe alternative.
Right, right, yes. Ma'am, since we spoke about acute bronchitis and productive cough, and you also mentioned about asthma, and with budesonide, can it be given as an adjuvant therapy? The dried ivy leaf extract cough syrup.
Yes, definitely. The trials which were done, they were done in asthmatic children also. So,
Hmm.
the drug of choice in asthma will remain as beta 2 agonists and inhaled corticosteroids and all those drugs. But
Hmm.
yes, for general condition, for general well-being, and for alleviation of symptoms, some
Hmm.
cough syrup is always needed, even in asthmatic patients. So,
Hmm.
dried ivy leaf extract, when it was in those clinical trials, it was used as an adjuvant treatment.
Hmm.
The effects were much more significant, both clinically as well as statistically. Also, the effects were very
Hmm.
significant in those trials.
Hmm.
The effects was more measured in the terms of pulmonary function tests. There are certain parameters which we measure by spirometry, like vital capacity, forced vital capacity, peak
Hmm.
expiratory flow rates, and all those measures which we take. Those
Hmm.
showed significant improvement when we used ivy leaf extract as an adjuvant therapy. And
Hmm.
along with it, the clinical score was also very high, as
Hmm.
rated by physicians as well as the parents. So,
Hmm.
yes, we can use it as an adjuvant treatment in asthma. But
Hmm.
the point is not in acute exacerbation. If the child is coming with acute exacerbation, we need to hospitalize the child and go with the usual protocol. But in cases
Hmm.
of mild or moderate persistent asthma, yes, we can
Hmm.
use it as an adjuvant treatment.
Right, right. So, ma'am, again, wonderfully explained about the in acute exacerbation of asthma. It is as an adjuvant. It can be used for as cough syrup. It can be used as an alternative. And so, ma'am, also, COVID is another pandemic that we just went through, and mild cases are coming in, and the numbers keep decreasing. So if there is another wave of COVID, which if it comes, so does dry leaf extract cough syrup can be used for mild asymptomatic COVID cases?
Regarding COVID's fourth wave is probably around the corner. So we definitely need some of the medicines which we can safely give to our children, which don't cause any side effects per se. Yeah, one thing is that we can't cure the disease per se with these cough syrups, and again also with ivy leaf extract. But yes,
Hmm.
for improving the general well-being of the patient, for easing out the life of the child, we can use it as an adjuvant therapy, as in the form of cough syrup, along with other modalities like hydration, and then antipyretics and rest and all those things. So yes, we can use it along with other treatment modalities.
Right, right. And ma'am, how long do you prefer giving, say, dried ivy leaf extract cough syrup for respiratory infections, or say in productive cough or in bronchitis? Is there a separate regimen that you follow, or or what is the period of like a duration that you prefer giving?
In certain diseases, respiratory problems like in viral respiratory infections, both upper and lower tract infections, then in acute and chronic bronchitis, since the symptom relief is very fast, so in within
Hmm.
2 to 3 days we see a lot of change in the relief of the symptoms. So
Hmm.
we don't need to give it for more than 7 days, because the child becomes all right beyond that. And as long as if we give it for 10 to 14 days also, it is very safe and useful.
So here the dosage. So ma'am has wonderfully explained not just how dried ivy leaf extract works in respiratory tract infections, but also the importance of dosage and the safety profile and the duration that it works best in. So this was a wonderful and highly insightful interaction that we had. Ma'am, if you could give your clinical experience with dried ivy leaf extract cough syrup, any particular or any experiences that you would like to share with us?
So as per my own clinical experience, I have been using it for past quite a few years, and not in all of the children, but in those in which it's been indicated, I definitely use it. And the way the children are accepting it, the way the children are tolerating it, it's very very really, I'm very, very relieved to see that. So in the end, I just say that I am happy to give it as long as children are happy to accept it, and as long as parents are happy to see their child accepting it and getting well.
Hmm. Right. Wonderfully again, shared by you your experience with dried ivy leaf extract cough syrup, and makes us happy to know that you had positive results in your clinical practice. Ma'am, any final message that you would like to give to your viewers regarding, the use of dried ivy leaf extract in prolonged wet cough?
The final take home message from me would be that we can use ivy leaf extract as a very safe and effective therapeutic adjuvant in the management of wet cough in children suffering from respiratory diseases like upper respiratory infections, acute bronchitis, chronic bronchitis, and even in some cases of persistent asthma. It is well tolerated, it is very safe, causes very little adverse drug reactions, nothing practically, and it's approved. And last but not the least, it is approved by DCGI, even in India
Hmm.
also. So we can use it safely.
Right. Yes. Very important for our viewers to know that the dried ivy leaf extract, which is widely available now and is safe and can be used in children for productive cough and for multiple other respiratory tract infections. So, thank you so much, ma'am, for sharing such great insights. And it was a learning for all of us. And I'm sure that the audience have got a lot of great information regarding the use of dried ivy leaf extract. So, thank you, ma'am, for taking the time out and for having this wonderful interaction with us. Thank you.
Thank you so